What is good, people, and welcome to another episode of Real Talk with Marcus McCoy. Definitely glad to be back. We got a great show planned for y'all. We're going to be talking about mental health, which is a topic that I feel like we can never talk about too much. But I'm going to go ahead and introduce our guests for today's show. I've been really looking forward to speaking to them both. So we have Meg Kissinger, author of best-selling book While You Are Out, an intimate family portrait of mental illness in an era of silence. And we also have Joseph Feldman, who's the founder and president of Cover My Mental Health. Welcome you both to the show.
Thank you so much. It's great to be here.
Absolutely. So we're going to go ahead and dive right in. For the people who are watching and listening, could you tell the listeners a little bit about yourself?
Sure. I'm a longtime newspaper reporter. I live in Milwaukee, Wisconsin. And I'm also a member of a big, kooky, loving Irish Catholic clan. I grew up in Chicago. I'm the fourth of 8 kids. And in our family, we experienced a great deal of love, but also a great deal of mental illness. And that came at a time when we didn't really know how to talk about what was going on around us. We didn't know what was happening.
Right.
And so this was something that was a curiosity. It was a sorrow to me, and it was a curiosity. So ultimately, I became a newspaper reporter and spent a career writing about our nation's fractured mental health system. And most recently, I wrote the book that you referenced. And it's a memoir. It's about my family. It's about what it was like growing up in the 1960s and 70s, when really several members of my family experienced crushing mental illness without the resources or the knowledge to deal with that.
All right. Thank you. We definitely look forward to diving in later on in the segment about that book and those conversations. Joe, go ahead and introduce yourself, good brother.
All right. Thanks, Marcus. It's great to be here and great to be with Meg. We've had a chance to spend some time together over the last year or so. So I'm Joe Feldman. I'm based just outside Chicago. And as Marcus mentioned, I founded and now lead Cover My Mental Health. We're a nonprofit focused on helping people overcome insurance obstacles to care. So I've been involved in this area of advocacy for half a dozen years, all focused on helping individuals deal with insurance obstacles. And I started Cover My Mental Health about a year ago. And I'll say we're off to a pretty good start.
Absolutely. Love what you both are doing for the community, especially being advocates for mental health. I gotta tell the story of how me and Joe met before we go a little deeper into the story. So actually, Joe, he and I met at the National Alliance on Mental Illness Texas annual conference last year. And man, like when I say we just hit it off from the beginning. And we've been in touch ever since, just conversing, going over things together. And then I had the pleasure of him introducing me to Meg, who's phenomenal. And here we are, guys. I love it when a plan comes together.
That's great. Me too.
Yeah, be it Joe.
Absolutely. This is an advert.
Yeah, we talked for about an hour, right, Joe? We didn't want to leave each other.
That's great.
No, we are an advertisement for why virtual conferences are not as good as being there in person. We met at the opening reception and that was it. Everybody else was running around and we just kept talking. It was awesome.
Yeah, we had a great time. All right. So we're going to go ahead and dive right in. So I'm going to start with Meg. You kind of touched on it earlier in the opening, but just kind of give people an overview. What is your personal experience with mental health, mental illness?
Sure. So as I referenced earlier, I came from a family where we had a lot of mental illness. And again, I say this with no disdain. I had a great love and admiration for my mom and dad, and my brothers and sisters. But the fact of the matter is that we were, again, coming up in a time when mental illness was so poorly understood. So my mother struggled with depression, but we didn't call it that in those days, of course. She would just kind of go into a funk and retreat, from family life for a while. Not long, there were 8 of us. We had to eat and laundry had to be done and, all those things. But we knew that something wasn't quite right with her. And likewise, my father, who we now know had bipolar. But again, in those days, we didn't have a word for that. So he would have pretty, wide mood swings. He'd be very up one minute and very down the next. So you can imagine with, again, all those kids living under one roof and 2 parents who were really not as healthy as they needed to be to rise to that occasion. So my experience with living with people with mental illness came from birth. And so I knew what that was like. And as I referenced earlier, also by not having the language to talk about it, not knowing what we were dealing with, it was a curiosity to me. So I was fortunate, to have a career as a newspaper reporter where I could turn to total strangers and ask them these very probing and intimate questions about the illnesses that they were struggling with, because I was too afraid to really ask the people that I loved the most. So I got a great education over the years in what it's like for families when there's a great deal of mental illness from within. And I can tell you, that it won't come as a surprise that it's very hard and you need professional help, just as you would if somebody in your family was struggling with diabetes or heart disease. But those were benefits that we were not afforded. So that's why when I met Joe a little more than a year ago, I was just so thrilled for what he is offering to the world, which is to help families navigate, these very real tough barriers and challenges to getting good mental health care.
That is awesome. That is awesome. Same question for you, Joe.
Sure. So, I think of the challenges around mental health as sort of a all of the above opportunity for people to get involved. My experience is different, but I think complements Meg's quite well. I got involved in our community's youth commission almost 25 years ago, which was a part of our village government, and we focused on issues related to social and emotional wellness of youth in the community. And little did I know how much that work was going to help me to understand some challenges that both of our kids had, and our daughter in particular had some challenges early in high school that required pretty significant care, and she ended up on the advice of her psychiatrist going to a residential program, which my wife and I knew was a better option than anything we'd found so far. And so we were able to, I'll say, wrap our minds around her getting that care. And not long before or not long after she arrived, our insurance company said, by the way, that care is not medically necessary and we're not paying for it. So we were, I'll say, mostly shocked that they came back with that determination. And that I'll say thrust me into the middle of the advocacy work, because the insurance company was wrong. The care was medically necessary. And ultimately she completed the care, and she's doing, I'll say, pretty well now. She's got the problems of a young adult as opposed to the more significant issues that she had back in the day. But it took our winning a federal lawsuit against our insurance company before they would pay the claim. That's just not a normal way for people to access the care they need. So that whole experience, really motivated me to get involved in advocacy, and ultimately last year starting up this nonprofit with the motivation that families should not have to go through what we did in order to get access to care for themselves or for their family members.
And Joe, I would add that. So, Marcus, Joe and I both Joe lives in the town that I grew up in, Wilmette, just outside of Chicago, which is
Okay.
a beautiful community. And we had means. We were very fortunate. We had financially. So, if you can imagine that people that had some wherewithal, financial wherewithal, met these kinds of challenges, what do all people of all backgrounds and all, especially socioeconomic backgrounds,
Gotcha.
people without the means to hire, to pay out of pocket for their mental health care. I watched in our family, my mom and dad had saved, for all of us to go to college. And I watched all their education, their college fund disappear because my second oldest sister, Nancy, so desperately needed residential mental health care back in the 1970s. And it was all out of pocket. Not one penny of it was paid for. And so, the whole family struggled because of that.
I can appreciate too the dynamic of the particular era that you grew up in, and this is something that I talk to my parents about all the time. Is um, the time frame you guys grew up in was
Mhm.
obviously a different time.
Mhm.
There was a lot of, and I mean some of that is still kind of in my time frame too, but there was a lot of, I wouldn't even call it a stigma necessarily. I think there was just mental health and mental illness was something that we just weren't talking about as a
Right.
family, as a society. Um, I would almost ask when you were in grade school, that wasn't something that, you probably didn't talk to counselors or anything about
No.
that kind of stuff, right?
Nothing, no. And Marcus, I lost two siblings to suicide. So my
Sorry.
sister Nancy, the one who struggled so much that, my mom and dad, again, spent all the college funds to help her. She ultimately died, by suicide. And then many years later, my youngest brother also took his own life.
Sorry to hear
So thank you. And if you can imagine, we never had family counseling. And it wasn't because we were, nobody was trying to be mean or there was no cruelty behind that decision.
that.
It was just that wasn't ever offered. It wasn't even thought about. So, it was not on our radar screen. It was just nothing that we ever considered. We know now
Yeah.
how important that is. But, when we talk about the stigma behind mental illness and how it is that we tend to blame the people who struggle with it. We look at them as though that they were either morally defective or their parents didn't do a good job raising them. And that's not the case. They have an illness. We're coming to understand that so much more now. But the fact of the matter is, a great deal of discrimination really still does exist against people living with mental illness. And that's why, that people like Joe and the work that he is doing they're so critically important.
So that brings that's a great segue into what I'm about to ask. So Meg, this question is for you initially. So like you just talked about discrimination. So how does discrimination against people with mental illness impact their access to treatment and quality of life?
Yeah, greatly so. So if you can imagine, like, even it's as simple as when you call to get approval to see a professional. So let's say you can't get out of bed, you're hounded by depression, and you're feeling so low, and everything feels so heavy, and you're confused, and you don't know where to turn, and it's scary. Now, if you had a physical symptom like chest pain or a cough, let's say, you would know to go to the hospital or what doctor to call. But with mental illness, there's a separate telephone number that you have to call to get insurance approval.
Mm-hmm.
And as Joe knows all too well, very often those decisions are being made by medical professionals who have no experience in psychiatric care.
Right.
They pay doctors to look at case files and make a decision, thumbs up or down, on whether or not they're going to get treatment. So discrimination greatly affects whether or not somebody gets the care that they need. And then it continues in other facets of life too. Discrimination at work against people with mental health challenges and not being able to get sick pay for their depression or whatever mental illness they're going through. The kind of the presumption that they're faking it. And then extending it further still, let's say you're unable to work because of your mental illness. Where do you live? So housing, discrimination in housing against people living with serious mental illness. So it goes on and on.
Absolutely. I know you want to chime in on that one right there, Joe. I feel it. You ready to talk, brother? Go ahead.
Do it.
Yeah, I think I'd say my focus around insurance obstacles has taught me that there's a very, very high level of discouragement among clinicians and among patients and their families that insurance is going to be covered when it comes to mental health. So when, just to pick up on the thread that Meg started, when you have chest pains and you go to the emergency room, it really doesn't cross your mind, or if you're bringing a family member, it doesn't cross your mind that the coverage is going to be there for the care you need. And I had an opportunity earlier this year to hear a presentation by the president of the American Medical Association, Dr. Jesse Ehrenfeld. And he was saying how when he practices medicine, basically the insurance company isn't in the operating room with him making decisions. And he said that when it comes to care for mental health, that when someone shows up in the emergency room, it's not the same. Insurance companies may be there to say, by the way, we're not covering this particular need for care. And when that sort of uncertainty is in the mix, it adds a level of complexity, I'll say, exactly at the moment when that additional burden is most unwelcome. The person and their family, they want to get the care they need right now. And they're not really interested in taking on the challenge of dealing with an insurance company, deciding that maybe they don't need that care, or maybe you could do something a little bit less significant to get started, or maybe you could try, just go see a therapist once a week instead of being treated at a higher level of care than is required. Those are all barriers that stand in the way of people getting the care they need. And in effect, they take advantage of someone who just has less wherewithal, whether it's financial wherewithal or energy or attention, to be able to say to the insurance company, cut it out.
Right.
And what it does too is it puts you in a defensive crouch. You are immediately having to justify, why do you need this care? And maybe some of that, is true, whatever the illness is, but it's especially true, it seems to me, when it's a mental health concern. And you can imagine that, it's reasonable for people to guarantee that, or as best as they can, that you are really in need of that care. It becomes sticky when it's matters of the psyche, of psychiatric issues, because there's not a blood test or an X-ray. So it's really anecdotal. Nonetheless, some of these things are just as deadly. Some of these illnesses and outbreaks of, the psychotic behavior can be quite lethal. And so just the burden on the patient to have to justify care really interferes with them getting the help that they need.
Yeah, and like you said, that burden would be a lot for anybody, especially when, they're actively seeking help. Let's think about a lot of people that we know, or we've, ran across or heard about, that have not taken the opportunity or don't seek help, right? Which kind of goes back to this point. I'm sure you all are aware of the tragic events that happened in New Orleans just last week. And I think those type of events or I would say like a wake up call, even though, unfortunately we've had a lot of wake up calls over the past X amount of years in terms of people with mental health, mental illness. And so, when, we were initially talking about coming on here and having this discussion, I always say that we can't talk about mental health enough. There's not enough hours in the day to discuss this very essential topic. But having that happen also, for me, just reemphasizes that the conversation we were going to have today, it needs to be continuous. And then we got to have some action items behind it, because, there's a lot of, hey, let's do this, hey, let's do that. But sometimes people don't have the follow through, or like you said, the wherewithal to make these things happen. So I just feel like right now in this particular space we're in the right space to be talking about this very important topic.
Yeah, absolutely. And Marcus, you bring up this great point, and I get asked all the time when I go around the country talking about my book, and people all say, what can I do? And it's overwhelming, when you think about what can you do. I mean, you're up against some pretty strong walls, some pretty tall, fierce, thick walls. But I think what we can do, and this sounds very squishy, but I believe it to be necessary, is that we can learn how to have these conversations with one another. It really starts so fundamentally in our own home, and with us, with learning how to be comfortable to approach somebody who is struggling with depression or with anxiety, or is maybe so ill that they can't appreciate how much they're struggling, and to be patient with them, to have these, hold their hand, sit with them and have a conversation with them. How are you feeling? I'm sorry that you're scared. I'm sorry that you're lonely. I'm sorry that you're feeling inadequate. And what can I do to help you? And let's go to the doctor together. Let's talk to somebody and figure out how you can feel better. So both the patience and the courage and the humility, to learn how to have these very important conversations with people that we love.
Absolutely. That's kind of ironic too. I was just listening to you. I took it was last year sometime. I took a mental health first aider class for adults.
Bless
and when I'm listening to you about, offering to go to, the doctor and those type things, it reminded me of some of the stuff that we learned in the class. I want to come back to Joe, because he made me think about something too. Well, both of you did. Is Joe, do you remember me telling you when I attended your class at the conference, I told you that I had never ever thought about the way you presented that in terms of an insurance and having that coverage when it comes to mental health, right? Because again, like Meg said, when you go, you just expect to be taken care of, right? That's your expectation when you go to any doctor of any kind, right?
Yep.
And so when you don't get those needs met, like where do you go? So my question is, what are the reasonable expectations individuals should have from their health care or health insurance when seeking mental health care, and how can these expectations be upheld?
Right. So, I've had health insurance for all my life, and your expectations, you don't even really think about them, right? But if you were to ask somebody, what do you expect from your health insurance company? I think what they would say if they thought about it is, well, first thing is, if I need some help, I'm going to be able to go to the directory, or I'll go to the primary care physician who's in my network, and go to that clinician and get started. So the first thing is that you'll be able to find a clinician. And the second is that clinician is going to be expert. And the expertise might be to treat you, or that expertise might be to refer you to someone who has different expertise that might be helpful to you. And then you're going to expect that whoever's treating you along the way is going to be able to make the decisions about what care you actually need, and to be able to provide that care. And then you expect that your insurance company is going to pay the claims, which is to say, of course, there's going to be deductibles, and there might be co-pays, and there's going to be some rate that's determined by the insurance company, because after all, they've got the clinician is in their network. So presumably they've taken care of the financial side. And so they're going to pay the claim. And then in the event that there's any sort of a dispute or confusion or something, you would assume that it's going to get worked out, and it's going to get worked out by the people who have your interest in mind and the insurance company's commitment to you to cover to cover your care, right? And these are not expectations that I'll say just dreamed up. You can go to the website of any of the major insurance companies and read their marketing language, and their marketing language all focuses on, we're going to provide you with the right care at the right time, and we're there for you and all that. But the reality is different sometimes. And those very basic expectations, those reasonable expectations, aren't met. And that's really where Cover My Mental Health is trying to step in and help individuals and their family members. And by the way, also to help clinicians who are also in the middle of this mess, to be able to get back to the realizing the expectations that you have. So you want to be able to find a clinician who's in your network and available nearby and soon. That's not hard to imagine. And when an insurance company says, well, that care is not medically necessary, so we're not going to pay for it, we're going to deny the claim, to be able to have a resource like a medical necessity letter, which is one of the key resources on our website, where the clinician can use our template to document, I'm Dr. Feldman, so I'm not a doctor, but if I were writing the letter, I'm trained in the following way. I've been treating this patient for XYZ amount of time. And here's how I've applied my expertise using the standards of my field to make an assessment about the care that's medically necessary and to sign it. And that's the documentation. So the reasonable documentation that says to the insurance company, I think I'm the right person to make this decision. And if you have a concern about my decision, then please be specific and explain why you think I may have gotten it wrong. It's possible.
It's such a genius idea, Joe. And, I've got a couple of good buddies who are doctors, and they're not psychiatrists. One is a rheumatologist covering people with arthritis and other issues, physical issues. And she talks all the time about how she goes up against insurance company denials for those kinds of claims. And she's become so much more aggressive in recent years to say to the person from the insurance company who's denying the claim for her patient, to say, can you please spell your last name? I'm writing all this down because when my patient sues you, I want them to know, who it is who in particular who denied this claim. And so if you can imagine that that's happening, with illnesses that aren't whispered about and that aren't kind of, held up to this kind of secrecy as many mental health claims still are, although we're getting better about that. You can see that it's too easy for these claims to be denied, and you do have to be bold. And that's why what Joe is doing here with these very clear and proactive measures to get insurance coverage is genius, I think.
Absolutely.
So maybe I could jump in. So we've estimated that there are between 15 and 22 million claims denied every year by private insurers for mental health and substance use disorder care.
Hold on, Joe. I need you to say, I need you to repeat that again. I want to make sure I heard the number right, and I want to make sure everybody else heard the number right as well.
So so Cover My Mental Health has done the analysis of how big an issue we're trying to get after. And our estimate is that between 15 and 22 million mental health and substance use disorder claims are denied every year by private insurance companies. So that's a big number. And
this is after, so 30 years ago, almost 30 years ago, parity was put into play where federal law required that coverage be equal, no matter if it's psychiatric or if it's other illnesses. But the execution of that has been quite flawed and lacking. It's getting they're working on tightening it over the years, but it still falls way short. Now, Joe, those are staggering numbers.
Absolutely.
15 to 22 million claims each year.
So one I'll say story, let's go with, that insurance companies are sometimes heard to say is that, of course, we're going to treat mental health claims the same as physical health, but we just want to make sure that the care is medically necessary. And so at some level, I'd say that's good, plausible deniability. The whole point of a medical necessity letter is to put in writing the very basics that I mentioned. As the clinician, I'm trained in this area. I'm practicing in this area. I've seen this patient and have observed their status. I'm applying the standards of my training, and this is the care that's medically necessary. And putting that in writing, I'll say at some level, it changes the conversation, I think, a little bit for clinicians. So at one level, I agree that clinicians and individuals need to be more bold. At the same time, the resources that we provide are more intended to provide confidence than boldness. And maybe it's a small difference. The difference that I focus on is I want people to be encouraged that their reasonable expectations are completely unremarkable. Of course, the insurance company should provide you access to competent clinicians nearby and soon. And of course, those clinicians should make decisions about what's medically necessary for you. And that's just normal. And so when it comes to talking to an insurance company by a clinician, or let's say communicating, because it could be maybe better done in writing, the idea is that you don't have to be bold. You have to provide evidence. And the evidence of a medical necessity letter is maybe an easier ask to a clinician, which is to say, document your expert determination. That's what we're asking you to do. It's something you're familiar with from your training. To say, we want you to be more aggressive. It's like, some people might be uncomfortable with that. Others might think, okay, I love a good fight. But for the most part, it's exhausting and just takes, it takes a level of time and energy that the clinicians don't really need in their day. So to be able to put go ahead, Meg.
Yeah, and I'm sorry, I didn't mean to interrupt, but I was just going to say the fact of the matter is people living with serious mental illness, depression and anxiety, bipolar maybe, or schizophrenia, they feel badly enough about themselves anyway. And I think harkening back to what we were talking about when we first came on the show, is the burden, the special burden that people with mental illness feel, that they feel inadequate, they feel unlovable, they feel unloved, and they are not the best advocates for themselves because they feel so poorly about themselves. They're so oftentimes so confused, and it's a big enough kind of hurdle to get a person living with serious mental illness to acknowledge that, because the fact of the matter is we still make people feel ashamed, and shame is a terrible way to feel, and shame is quite toxic, and shame can kill you. So I think it begins with us making these conversations welcoming and encouraging, and giving people the platform or the ability for them to advocate for themselves.
You want to chime in, Joe?
Yeah, no, I think, going back to what I was saying earlier, what we try to do at Cover My Mental Health is provide two things: encouragement. You can do this. Your reasonable expectations are reasonable. And then resources that you can use today. So a template medical necessity letter, a script of what to say or what not to say to an insurance company customer service rep. Resources that you're not going to find in your insurance policy, right? So insurance companies I think every insurance policy I've ever seen, health insurance, says if you have a dispute with us, file an appeal. And there's a time and a place for an appeal. An appeal is not necessarily, though, the best place to start. There are many steps that can be taken before an appeal. Putting a medical necessity letter on file is one of them. Putting together a document that says, I called 5 or I called 10 clinicians in your directory and I couldn't get an appointment anytime soon anywhere near me. That doesn't require an appeal. Filing what's called a formal complaint against an insurance company. That's also not an appeal. It's a different process that insurance companies are not going to tell you about, but they create an important workflow within the insurance company that might be favorable to overcoming your obstacle. And another, which I really encourage people to think about, is after you've taken some steps on your own, one of the resources that you could consider is government. And that could be resources at your state Department of Insurance or even the federal Department of Labor. They have helplines, but also calling your state representative, your elected officials. Same with your federal elected officials. Every one of those elected officials has what's called constituent services offices, and those people are there to try to help constituents deal with issues. And we're going to have up on our website later this week a video that that I took when I was down in El Paso, Marcus, when you and I first met, and I talked with a woman who works in the Texas legislature, and she was in the workshop that I led, that you attended, and I was talking about how constituent services can play a role when you've made some steps and you're just not getting the results you want. That's a place you can go, is call your elected official. And she stood up and said, "That is exactly right. That's one of the jobs that I have, is to field questions from constituents and then go to the insurance companies and say, why are you doing this? Why are you treating my constituent this way?" And the good news is I've talked to several former insurance company executives, and they've told me that's the worst call of their day. They really do not like to hear from the office of an elected official on behalf of their constituent.
Well, the problem is sometimes we don't have these adequate checks and balances. So, it seems like in some cases where it's completely unnecessary, sometimes you had to elevate something that could have been handled at this level and take it to another level, especially, again, when we're talking about something that's so sensitive as mental health. I don't think that is, I'm hoping this doesn't happen, but I can see that being something that happens more in the future, that people are gonna continue to elevate these situations to get the adequate care that they need. What do you think? You think that's gonna be on the rise especially as we get more educated?
I think so. First of all, because I think we are becoming more welcoming for people to identify as struggling with their own mental health. When I think about my brother Danny, so my brother Danny, who died by suicide in 1997, we knew for years that guy struggled with bipolar. But the last person to acknowledge that was my brother Danny, and by then it was really too late for him. So he was ashamed, he was embarrassed, he was angry, and when I think now about how people are more forthcoming about their struggles and more willing to acknowledge that they need help, and that's really I'm thrilled that we're making those conversations more easily available, and then they're more likely to demand the care that they are entitled to in the same way. I tell the story all the time about back in the early 80s when the AIDS outbreak first came about, and in New York City and in San Francisco, there was really a push by members of the gay community in the arts community. They were so frustrated that everybody was ignoring these people dying right and left of AIDS, and the federal government wasn't doing anything about it. The New York Times would not allow obits to be published of people who died by AIDS, of AIDS, they wouldn't identify people who had died of AIDS. And it was really a groundswell. It was a grassroots a grassroots movement that really pushed this into the public consciousness. And through their theater and arts and music, they really demanded that people pay attention to those people who were dying by AIDS. And we see now what happened. They've come up with medications to treat it. People are now sadly, people still do die of AIDS, but not in the numbers that they once did. And it's not this, secrecy swept under the carpet. So I think the more we can do that with forms of mental illness, the better we'll all be.
Absolutely. You like, all right. Let it out, Joe. You ready to chime in, brother? I see it.
No, I think it's true. I mean, you do see reports in the news now when people die by suicide, and you don't see the sort of mystery of cause of death was not mentioned and all this. I think we're all just better off helping one another. It's just, at some level, it's just not that complicated, right? We can help one another. A good friend of mine quotes, I think it's Maya Angelou, who said, we know better so we can do better. And I think that's the bottom line. There are things that we can do to help one another. Encouragement is one of them. Resources is another. A shoulder to lean on. Having this conversation. If we help one person as a result of this, then we've had a great year. I mean, that's the bottom line. It's that important, and it's also, I'll say, that easy. It's that easy.
Absolutely.
So my view is, what are we waiting for? I think, Meg talked earlier about how the laws have been in place for quite some time, specifying that mental health and substance use disorder care has to be treated the same as medical and surgical care. And I've had the opportunity to testify to state legislature. I've had a chance to talk to federal and state regulators and legislators. And I'm all about the enforcement of and the enactment of better laws and regulations to make that happen. And at the end of the day, I'm just too impatient to wait for that. And that's really what Cover My Mental Health is about. When I was first thinking, when the idea, I'll say, first started to crystallize for me of this online resource, I started thinking about all the resources that are available to someone to help them with their insurance problems. And the vast majority, in fact, I'd say all but ours, fundamentally focus on how the law is on your side. And here's how the law can work for you. And from my own experience and from talking to so many people involved in advocacy and family members with mental health issues and substance use disorder, when you're in a crisis, it is not helpful to you to know that the law is on your side. You want to know, what do I do today? Like, before I go to sleep, what can I do? Mm-hmm. And picking up a book and reading about the latest legal case or the federal law or something like that is not going to do it. What you want to be able to do is find a path forward. And that is 100% what Cover My Mental Health is committed to do, is, as I said before, encouragement and a resource you can use today. There's no, another thing you'll hear me say is, we provide no legal seminars on Cover My Mental Health. We're not going to teach you how to navigate health laws. We're going to tell you, here's a step you can take today.
I mentioned that I was a newspaper reporter for 35 years. And in a lot of that time, I spent covering the failures of the mental health system and how families suffered because of it. And it never ceased to amaze me how I would get phone calls all the time from frantic family members. What can I do? My kid is reeling out of control, or my husband won't get out of bed. And I thought, how sad is it that they're calling a newspaper reporter for this kind of help? But I also am mindful of the fact that there's still so much that we don't know about the causes of mental illness and how grounded they are in our genetics. So when we separate, the psychiatric illnesses from other illnesses, I think that's a mistake. Clearly, you look at families like mine that have such a prevalence of bipolar in our ranks, that certainly must be genetic.
Yeah.
And so we still don't know enough about the causes or the root of mental illness. And we certainly don't know, sadly, about really very effective. There is some treatment that's effective, but certainly not a cure. And so it frustrates me that we separate when we talk about psychiatric illnesses and other forms of illnesses, because I feel like they're really very much one and the same.
Gotcha. You see the correlation. Let me ask this question, Meg. I definitely don't. I'll be remiss if I didn't ask this question. I want to make sure I get this out there. With your book, could you just talk to us, give us a inside snapshot, some things to look for, what the book is about?
Yeah, sure. I just happen to have a copy right here. So it's a story of it's a kind of two parts. It's a story of my family and what we all went through, as these illnesses began to present themselves again, very much of that era of the 1960s and 70s. And then the second part of the book is really what I learned as a journalist about, the failures of the system and what we need to do, to overcome those. And so a lot of the things that we have just spent time talking about, but I do go into, there is an amount of mental health history. I recall how it used to be that people were kept in these big, scary asylums at the outskirts of town. And then along came in the 1940s, this real clamor for reform, which led to ultimately deinstitutionalization. So emptying out all the hospitals. And this great plan that was put in place by President Kennedy in the early 1960s, the Mental Health Act of 1963, which never really came to pass. They ended up not building more than half of the facilities, the community-based facilities. So there's a good deal of mental health history in the book too, but it's a little bit of everything. It's my family story. It's, again, mental health history. And then I think there's some good practical advice in there too for families who are struggling and what they can do to help themselves and to help each other.
Absolutely, absolutely. So first and foremost, I definitely want to thank both of you for coming on. We're gonna be in touch a lot throughout the years.
Oh, Marcus, I thank you.
I can already tell, and I appreciate so much what you both are doing for just for the community in general. I mean, we need more people like you both that are advocating for mental health. Before we get out of here, what is the final thoughts you want to leave with the listeners? Meg, we'll start with you.
Well, just gratitude, gratitude for this program. Marcus, thank you so much. And, again, for Joe and the work that he is doing, which is so important. And yeah, we need to just let our voices be heard and our rights, the rights of people who really need it to be addressed.
Absolutely.
Yeah. Amen. Amen to what you said, Meg. Marcus, this has been a great conversation. As I said, if we can help one person, then that's all we need to do. I think that for folks that say, "What can I do?" I'll say at a personal level, you can get after the insurance coverage that you paid for. You can get after it, and on a broader level, there are so many organizations that would welcome help. Whether it's contributions, whether it's volunteering, whether it's speaking up in some other way, there's always action that you can take, and there's always an easy way to get started. So, as the advice that I got from someone earlier in my career said, "What are you waiting for?"
Absolutely. Absolutely. I love it as well. So for me, my final thoughts are we have this phrase in the military. We say, if you see something, say something. We oftentimes we see We see people going through things that we know are outside their normal spectrum, and we say nothing. We suffer in silence, and we say nothing. So I'm saying to those who are listening, those who might be dealing with an issue or know somebody dealing with an issue, don't be silent. We only have one life, and we have to do the best we can to live the best life we can while we're here. But until then, it's been a great show. I invite you to watch the next episode of Real Talk with Marcus McCoy. Until then, it's been real.